My name is Tracy Wade and I'm a Matthew Flinders Distinguished Professor of Psychology. I'm also the Director of the Flinders University Institute for Mental Health and Wellbeing. The Institute is unique, I think, for two reasons. The first is that we have an equal focus on both mental health and wellbeing. And in this day and age, it's not just enough to have an absence of a mental health problem. People want a quality of life, they want wellbeing. But we're also interested as a group about wellbeing across the population and in every sphere, whether it's work, school, everyday life. The second unique part of the Institute is that we have a blend of fairly unique disciplines. We have psychology, social work and education. And I think amongst that group, it really supports those two aims of mental health and wellbeing very well. The Institute has a focus on really practical outcomes, on really making a change at where it matters, where people will experience it. And we do that across our 5 pillars. We have a focus on eating disorders, on child and youth mental health, sports and activity, older people, and also trauma. Another really important part of our child and adolescent mental health work is the work in bullying, and that's been carried out both in schools and in sporting arenas.
So Big Talks for Little People has been developed in the last few years to enable teachers to talk about mental health and wellbeing with primary school children and kids who are in early secondary school. We began with a very simple idea that you're never too young to talk about mental health, and what we wanted to do in the mental health field with young children was to experiment, and to experiment boldly in a contemporary way. So what we wanted to do was use a digital platform that teachers could use to deliver the program in their classroom. We also wanted to have a program that was engaging with for young children. So that's where we hit upon the idea of animations, and those animations were meant to depict certain critical happenings in young people's lives in the school situation. So what we did was we met with children in focus groups, and we asked them, what sort of things did you like about the program? And I also remember one of the kids talking about what he liked about the program. And he said, it gave us the opportunity to sit down in the classroom and talk about our feelings, because sometimes what you're feeling and what you show on the outside is not how you feel on the inside. The students were reporting that they were more able to recognise feelings and emotions. They were more able to use productive ways of resolving conflict in the classroom. We found that it significantly reduced the level of bullying amongst the students. And there was a cohort of students who had a very high level of anxiety at the time. And what we found was that significantly reduced that level of anxiety for that group of children who were at risk in that way for that level of anxiety that they were carrying with them. A more recent and very exciting initiative is that we're now working with our colleagues in Ankara in Turkey, and we intend to translate this program with them into Turkish for use with children who have been traumatised by the earthquakes that happened in Turkey this year. What comes after that is to expand this program even further into sports clubs, because we think that sport offers a natural opportunity, a natural vehicle for the delivery of positive mental health messages. Beyond that, what we want to do is take it into the school settings and have it embedded as part of the curriculum in school setting.
There are 2 sports settings that we're looking to introduce the Big Talks for Little People program. The first one is in health and physical education programs in schools. Primary responsibility for the education of health and wellbeing is with the physical education curriculum. Primary school teachers often teach the health education component of the curriculum in our schools in South Australia. Primary school teachers report around Australia that they have low confidence in teaching sensitive material such as mental health and wellbeing, that they're looking for quality resources to support their work in teaching this aspect of the curriculum. We have a validated program in the Big Talks. We know empirically that it makes a difference to violence prevention and bullying reduction in school settings. It's there laid out for the teachers so they don't have to do the thoughts around the content, how to teach it, how to assess it. So it provides them with the confidence to do this work in a school setting. The second area that we're looking to take the Big Talks into is school community and sport programs. We often think that the dominant reason for taking kids to sport programs in community is the sport itself, but parents frequently tell us that yes, they're interested in the sport, but they're more interested in the character development that occurs through engagement with sport.
We really value the partnership with Little Heroes and Breakthrough. The Little Heroes has recently funded a 5-year professor in child and adolescent mental health, and we're very pleased about that because we already have a number of strengths in child and adolescent mental health, and this position will really help us consolidate and extend this expertise.